They're in your blood vessels. It is guaranteed. So, Dr. Bardi then said to me, the way to prove this is we need to do a blood test called a D-dimer test to find out if this is really happening. So, because the problem with the blood clots that we hear about through the media, that they claim are very rare, are the big blood clots. These are the ones that cause strokes and heart clots in your brain. Those are the ones that show up on CT scans and CT angiograms and MRIs. The clots I'm talking about are microscopic. These are tiny, they're literally on a capillary level, and they are scattered throughout your capillary network. So they are not going to show on any scan, they're just too small and too scattered. So the only way to find out for sure if this predictable mechanism of clotting was actually happening was to do this blood test called a D-dimer. And so the D-dimer is a blood test that shows a recent blood clot. It doesn't show anything else other than a recent blood clot. It won't show an old blood clot, it only shows new blood clots. And so I have been now doing that on my patients, finding people who have recently had their COVID shot within the previous 7 days, it needs to be between 4 and 7 days, and doing a blood test on them called a D-dimer. And so I'm still trying to accumulate more information, but on the ones I have so far, 62% of them have evidence of clotting, which means that these blood clots are not rare. It means that the majority of people are getting blood clots that they have no idea that they're even having. So, Laura Lynn, the most alarming thing about this is that there are some parts of your body, like your heart and your brain and your spinal cord and your lungs, which cannot regenerate. When those tissues are damaged by blocked vessels, they are permanently damaged. So I now have six people in my medical practice with what we call reduced effort tolerance, which means that they just get out of breath much more easily than they used to. I have one fellow that used to walk to my office every week for an arthritis injection, who told me that he could walk 2 miles without any problem, and now after a quarter of a mile he is absolutely out of breath, and it has been like that for 5 months. So on the basis of this D-dimer test, which proves that the majority of people are clotting, these 6 people who now have reduced effort tolerance, literally what